Hi guys, welcome back to my channel. From the title, you can probably see that this video is not going to be a happy, bubbly, excited kind of one. Last week was one of, I think, the hardest weeks I ever have gone through, maybe in my entire life. But if you're new here, my name's Amanda, I'm 31, and I am currently 34 weeks pregnant right now. My due date is May 7th, and I have had a relatively easy pregnancy for the most part, but I did fail the gestational diabetes glucose test, and so they diagnosed me with that right away. I didn't even have to take the 3-hour one because my blood sugar levels were so high. So I have a high-risk pregnancy because of that. And so I also have a unique situation where my doctor is on maternity leave. So I actually haven't seen her since November. So that's like 4 months. And she went on a maternity leave in February, but before that, because I didn't really have any complications, I have been seeing the nurse practitioner. So it's kind of been a very weird situation for me. We moved from New Jersey out to Texas, so I had a completely new doctor and everything like that, and this is my first pregnancy. So everything is new territory. So basically, because of the GD at 33 weeks, my doctor recommended that I go in for another ultrasound just to make sure that the baby isn't measuring too big. I am just diet controlling the diabetes. I don't have to take any medication. So they just wanted to do an extra precaution of getting a ultrasound, and then after 33 weeks, I was supposed to come in for weekly appointments. So last week was 33 weeks, and I had my ultrasound last Tuesday, and I was so excited. It had been probably 2 months since my last ultrasound. It was like the anatomy scan that I had around like 22 weeks, I think was the last one. So was so excited to see the baby and everything like that, and was basically just like going into the day and the appointment just really giddy and happy. So we get in there, me and my husband, and they're doing the normal scan for everything that they do in an anatomy scan. I'm pretty sure, just making sure the size of the baby and we know that all of the organs are there and functioning and everything like that, but they just really wanted to check for the size. So she's looking, and these sonographers are not supposed to tell you any information. They're basically supposed to record all the results that then go to the radiologist, and from there the radiologist will interpret the information, send it to my doctor's office, and then my doctor would follow up with, you know, the information that she received. So the sonographer finishes everything and says that she has to just check with the radiologist that she got all the pictures. So she comes back in after that, and then she does some more checking. And then she leaves and says, just hold on for a minute. I'm just gonna double check on everything that I just put in, and then I will be back to let you guys know that you can leave. So she comes back maybe 15 minutes later, and she says that my fluid levels look really low, and that I basically have to go up to triage, like OB triage, for some reason. So I really don't understand what's going on. I'm just like, wait a second, this is really bad. Triage, why am I going up there? My fluid levels are low. Like I have no information at this point. And then she also said that the baby was looking a little bit small. So it was mainly the fluid thing that sounded like the reason why I had to go up there. So I get up to triage. I have to change into a hospital gown. They put an IV in my arm. They've got those monitors on my stomach to check the baby's heart rate and to check for contractions if I'm having any. And I am literally just in absolute shock. I have no idea what's going on. My husband has no idea what's going on. My doctor's on maternity leave, so I don't even know if the results have gone to my doctor's office or not. I had been seeing that nurse practitioner. And so finally, after, I don't know, maybe it was like 30 minutes or so. So the nurse comes in and she is asking me all of the routine questions and things like that. And then she also tells me that they recommend that I stay overnight to be monitored. So that just really freaked me out. I was just really terrified. I wasn't sure what was going on with the baby. I wasn't sure if there was anything wrong with me. I felt completely normal, which is really strange, you know? It's like a mother's intuition. They always say if something's wrong, but I didn't get that sense at all. He's every day on a regular basis a very active baby. I always feel him moving around. You know, he's kind of on a schedule. I felt really normal. Everything was perfect. And then I end up in this hospital. And so finally, after a little while, the doctor comes in and he tells us that they found that my amniotic fluid levels were low. Not dangerously low to where the baby was in any distress or in danger of anything, but low enough to cause a red flag to go up in their minds. And that's why they wanted me to stay overnight. And so apparently one of the amniotic fluid sacs was completely full, which was great, but my overall fluid levels were low. I think it was somewhere in the 5s, like low 5s or something like that, or 5.6. I can't remember exactly. So the doctor this is the on-call doctor, not my doctor. He tells us that we should stay overnight just as a precaution, and they just want to do some more testing. They want to do another ultrasound in the morning, or a couple different kinds, an NST and a BPP for the next day, and just to check if I was dehydrated. He was saying that he had another one of his patients was in the exact same situation as me, and her fluid levels were low. She stayed overnight. She got the IV the next day. The fluid levels went up. It was because she was dehydrated, and then she went home. So I'm not 100% sure. The first IV bag that I took, like, it was gone in 20 minutes. So clearly I was very dehydrated. So I was still just very shaken up. I was like, well, why are they low, blah, blah, blah. So it could be dehydration. I have gestational diabetes. I asked him if that could be a factor. He said, I don't know, like maybe not. It could be whatever. They just weren't sure. They also checked to see if my water had broke. So they were asking me, like, did I feel like a gush of fluid come out of me or like a short trickle or anything? And I was like, no, nothing at all. Like, so that definitely was ruled out immediately. They did like a test to see if my water had broke, and it hadn't. I was 33 weeks and nowhere near like that point in time. So that was kind of ruled out too. So that was basically like the fluid stuff. Doctor really reassured us that we shouldn't be overly concerned with anything. They just want to take the extra step and keep me overnight because in case there were any sort of complications, they wanted to make sure that they caught them. So that was reassuring. He also said that the baby was measuring small. So instead of measuring at 33 weeks, the baby was measuring 31 weeks. They said that he was 3 pounds, 11 ounces. So that's small from what they said. So that also scared me more. Like, is something wrong inside of me? Is there a problem with the placenta or the umbilical cord where he's not getting enough nutrients? Is the fact that I have gestational diabetes a factor in all of this? Because I've been very, very careful about monitoring the amount of carbs that I have. And carbs, like, I really wasn't eating many carbs at all. Not even like the good kind, like the whole grain stuff. So carbs hold on to water. And so I'm thinking like, well, I haven't been having a lot of carbs. Maybe that's part of the reason that my fluid levels are low. So there are just a million things running through my head, and I was just like a complete wreck. Like I couldn't even speak because I was just like torn up inside. So basically, that doctor kind of reassured us that things might not be as bad as we thought, and that, you know, they're just making sure that it's not a bigger issue. So, you know, we're just basically like sitting in the hospital and, you know, sort of freaking out. We heard from this on-call doctor, and we're just trying to figure out whether my actual doctor's office had all of this information and was aware of it, like knowing that I was sitting here in the hospital and everything. There was a lot of back and forth that happened between, you know, calling my doctor's office and trying to figure out what was going on. Are they getting this information from the hospital? Are they not? And my doctor's office is a complete shit show. Like, the staff just completely suck. And the nurse practitioner is running the whole practice because my doctor's on maternity leave, and everything was just like a very stressful situation. So fast forward, we stay in the hospital overnight. They tell us that I need to have another round of ultrasounds the next day to check on my fluid levels and everything. So I do that, stay overnight. It was the worst. Like, I did not realize the fear that I had of hospitals until I actually stayed overnight. I was just mentally not right. There was something about being in that hospital gown and laying in that bed and feeling like a patient, and I don't know, not myself at all. And then all of the fear of what's going on, and is my baby okay, and am I okay? What can we do to fix this? Like, it was just a very, very traumatic experience, and because I wasn't expecting any of it, I think it made it 100 times worse. Like, I was in this, you know, postpartum room for, you know, like 2 days basically. So the next day comes. I didn't sleep at all that night. At like 9 o'clock in the morning, they go and they give me these 2 other tests, what is it called? NST and BPP ultrasound. So I think that the NST scan is like the normal ultrasound, and the BPP one, the on-call doctor the day before had said it tests like whether the baby's happy in there, like, you know, kicking, moving around, that kind of thing. So I go for the ultrasounds the next day, and I get the results, and the good news was that my fluid levels did increase. So I think they increased to like 6 or something, and the on-call doctor the day before said that around 8 is a very good number, but below 5 is when they start to worry. So that first day I was at like a 5 point something, and then the next day went up to a 6, which was better. Not great, but better. So for the BPP test, the sonographer passed me on that one. So the baby was happy, moving around, kicking. They didn't see anything out of the ordinary. So later on that day, I'm back up at my room. We're still like not in the know, you know, like we got some more information, but not a lot. So we asked to see another doctor. We're like, okay, we were here all yesterday. We know what we know. What's going on from now on? So we asked to see another on-call doctor, and that specific doctor actually shares the same practice, like in the same office as my doctor, which was a little bit better because at least like they have the same staff that are scheduling meetings and stuff. So this doctor, Dr. Lee, she comes in and she had reviewed all of my information and the results from both of the ultrasounds, and she requested that I also get an umbilical cord ultrasound. So sonographer comes back up, checks the umbilical cord, and then we wait again. After waiting, we find out that the umbilical cord looks fine. It's, you know, bringing nutrients to the baby and everything. They asked me about my placenta. I told them that I have a posterior placenta. That's all that anybody has ever told me so far in this pregnancy. I don't have placenta previa or whatever it is. And they didn't seem to find anything abnormal there. So we finally talked to this Dr. Lee again later, and she breaks it down and basically says, yes, your fluid levels are low. Yes, your baby is measuring at 31 weeks when he should be at 33, but you're a small person. She asked us, you know, how tall I was, how tall my husband is. I'm 5'1". I take after my dad's side of the family, and they are very, very short. My dad is like 5'6". Pete is 5'7", so he's not that tall either. And I'm just like a small person. So she's like, it could be he might be small because you're a small person and you're not gonna ever have a 10-pound baby. And that's fine. And she was saying she had like a 400-pound patient deliver a 4-pound baby. So, you know, that kind of eased my mind a little bit. And she also said that I'm at 33 weeks. So that hospital, they deliver babies starting at 32 weeks. So if something happened, I would be able to deliver and the baby would most likely be fine. So aside from all of that information, she said because the baby is small, she recommends that I do steroid shots. So that would increase the baby's, the growth of the baby's lungs, so that if he were to come early, he would have developed lungs and he wouldn't have to stay in the NICU for as long of a time. So again, it sounded like another precautionary advisement from the doctor to do these steroid shots. So I, at this point, am just like, number one, I want to get out of the hospital. I'm just so done with being there. And number two, I just want to do anything that will help the baby. So we agreed to do these steroid shots. The thing about them is that they have to give them to me every 12 hours. So the nurse said, well, you know, we really recommend that you stay in the hospital and just get all of the shots, and, you know, we could do them here, because it was about 1 o'clock that day, so I would have to take them again 12 hours later. So that's like in the middle of the night, then 12 hours and 12 hours. Me and my husband talked about it, and we asked the doctor if I was in any danger if I went home that day and then took the shot while I was in the hospital at 1 p.m. and then came back later for the next one at like, you know, midnight, and then come back the next day 2 times to get the final. And the doctor seemed to think that it was fine. I was in no immediate danger. They had been monitoring the baby for, you know, 24 hours at that point. Everything had looked fine with him. He had a great, strong heart rate. All the nurses said so. I was fine. My blood pressure was fine. Everything like seemed okay. So I said, yeah, we're just gonna leave. So I got that first steroid shot, and then we left the hospital. And And then later that night at like, I think it was maybe 10 p.m., we came back and they monitored me for about an hour. They gave me the second steroid shot, and then I went home. The next day I had to come back at around noon to get the third shot. That was a whole nother fiasco. I'm sorry that this video is going to be so long, but there are just so many things that happened that I don't want to miss anything. So I come back for the third shot, and I go up to triage where they told me to, and they tell me that they can't give me the shot because they don't have the doctor's order. So this goes back to the confusion and shit show of the doctor's office, because my doctor isn't there. Like, their staff is just not, they're very disorganized. They don't communicate. Nobody's communicating with the hospital. Nobody's communicating with my doctor's office, and it's just really frustrating. So my husband like steps in, and he's jumping through hoops. He's calling the nurse practitioner, asking whether she got any of the results from my tests and if she knows about these steroid treatments that I have. And she's just clueless. Like, this girl, I'm sorry, my husband had it out with her. Like, she apparently had some sort of complex and said that she was offended that, you know, my husband was insinuating that she couldn't handle the doctor's practice, and it wasn't even that. It was the fact that she couldn't. She's a nurse practitioner. I hadn't seen my doctor for 4 months. I have this whole hospital scare, and at the end of all of it, she didn't even follow up with the hospital to find out what was going on with me. Like, her office didn't. I don't know if that's her responsibility or like the office manager or what, but that's the main problem that we have been having, is just like this breakdown of communication, and the fact that I have a high-risk pregnancy and I'm getting so close to the end. It's just not acceptable. I just didn't feel like I was getting the level of care that I should. And I was like in no emotional state to be on the phone with this woman, so my husband handled everything. Anyway, after he like kind of like ripped her a new one, they sent the doctor's orders over to the hospital so that I could get that third shot of the steroid and then the fourth one. And we also told my doctor's office that I did not want to see the nurse practitioner at all, and that I needed to be in the care of an OB until my doctor got back from maternity leave, which is supposed to be April 8th. So what is going on now is that the nurse practitioner and I are not seeing each other anymore. I am going to be in the care of Dr. Lee, who I had mentioned. She was one of the on-call doctors that wanted me to get the steroids and also ordered the umbilical cord ultrasound. So she's going to be seeing me for the next 2 weeks. And the course of action from here on out is that every Friday I will come into the hospital and get the BPP and NST ultrasounds, as well as the umbilical cord ultrasound. And I will also meet with Dr. Lee following those ultrasounds to discuss the results. I also was just looking at my doctor's orders here, and the nurse actually wrote on the diagnosis that I have Oligohydramnios, which I guess means the low amniotic fluid. So again, that's something that none of the doctors said I actually had, that my level wasn't so low that they would diagnose me with it. But now on my sheet from my doctor's office, it says that I have that. So I've got high-risk pregnancy with this oligohydramnios, whatever, and gestational diabetes. So I I've just had a really, really rough week last week. And I never understood what it meant to like have a love for your child. Like I didn't understand, you know, people say like this unconditional love and everything like that. Like I hadn't experienced that throughout the pregnancy until last week. And I was just a complete wreck, you know, like wondering what's going on with my baby and is he gonna be okay? Like, am I gonna deliver early? Am I gonna have to have a C-section? Oh, another thing, he's breech. So, I mean, I don't know. I've heard that they can turn on their own, like, even up to the day that, like the day that they give birth, they could turn or whatever. But that was just another thing that, you know, added on to the list of things that I was experiencing. So overall, I just had a my husband and I had a really, really tough week, and I'm still kind of a mess. I'm in a better place than I was, and I'm trying to reassure myself that a lot of the things that happened last week were done out of being over cautious, and none of the doctors ever said that I was in danger myself or that the baby was in distress or danger, you know, inside. And I kind of just have to rest on that. I have my ultrasound tomorrow, and I'm hoping that the results are positive. I have been drinking a ton of water because I was clearly dehydrated the last time. I've also kind of put my gestational diabetes diet like to the side. I'm not going crazy and like eating candy and cake and things like that, but I'm having more whole grains. I'm eating more food because maybe I just wasn't getting enough food, and that's why he's small. I don't know if the stress of the move these past 2 weeks and like my eating habits were a little bit different because we were just getting settled into the house and there was a lot going on and I was stressed because of that. I don't know if that is a factor. Like there are just, for me right now, there are so many unknowns, and it's hard to deal with, you know, like none of the doctors could say this is what caused your fluid levels to be low and this is what is causing your baby to be small. So they didn't even tell me to do anything different, you know, like they didn't say that I needed to be on bed rest or change my activity level or change what I'm eating or anything like that. So I don't know, I might be overreacting, but I can't help it. I've never been pregnant before. I've never gone through this before, and it's very overwhelming, and I don't know how to react to it. So this video has been super long, sorry, but I just wanted to keep you guys updated. Once I go to my doctor's appointment tomorrow, I'll make a video for next week to let you guys know how everything is going, and if I have more information, I'll absolutely share it. I'm praying that I get to 36 weeks. It's like every week now, every day that he's in there and like growing and happy and everything is a blessing. Every week that goes by, I am just so grateful and thankful for, and I'm willing to do whatever they suggest. I mean, if they say that tomorrow my fluid levels are even lower and I need to have an emergency C-section the next day, like I'm gonna do it. I will do whatever it takes for this baby, and it's crazy. I've never experienced something like this. I've definitely grown a lot in this past week. My husband has just been the most amazing throughout this entire process. We have a different kind of like love and appreciation for one another after this, and just like it brought us a lot closer. He has been amazing. He like just went to bat for us with all of the issues going back and forth with the doctor's office and the communication, and just like laying down the law, saying like, hey, I don't feel like my wife and baby are getting the care that we need. Like, we need to see an OB, and like just sorting out all of those situations, like, because I just was not mentally, I wasn't there. I couldn't argue with, you know, the nurse practitioner or anybody from the office. And even just like, he's so good at talking and getting more information. Like when I was listening to the doctors tell me what was going on, I just had so much running through my head that I couldn't even think of any questions to ask. But he was just on top of things, and you know, just so amazing. And then once we got home, he got me the sweetest little gift and like wrote me this letter. It was just, you know, telling me how much he loves me and the baby, and like he got like this cute little outfit and stuff like that. It was just like so sweet. And to everybody that is watching this that had known about the situation, because I did post a picture over on my Instagram about it. Thank you for the comments and reaching out, and like to all my friends and family, if you're watching this, like thank you so much for all of the love and support that you've given to us over this past week. It means the absolute world to us. We have such loving people in our lives, and really just like helping us make it through has been such a blessing. So that's all I've got to say. I'm gonna end this vlog. It's super long. Thank you for sticking along with me. If you've experienced any of these things, please let me know. If you've had low amniotic fluid levels, or if your baby was measuring small, if your baby was breech, like what happened, please let me know down in the comments, like your story and what your doctors told you, and you know, if your baby was okay, if your baby was delivered early or early or on time, and if you had to have a C-section for any reason, because I'm like feeling sort of like that might be the case for me. Maybe not, but I'm just trying to mentally prepare for anything. So thank you guys so much for watching. I appreciate every single one of you that has taken the time to you know, follow along my story, and I love you guys so much. I will update you next week after I have my appointment tomorrow. Love you guys. Bye.